So the main takeaways of this research are several. First off, individuals with the COVID diagnosis saw quite a significant increase in their post-diagnosis costs relative to their pre-diagnosis costs. And those varied quite a bit depending on the severity of the COVID experience for those individuals, as well as some of their underlying conditions. Observed claims for those individuals that had COVID tended to ramp up and ramp down before and after their month of diagnosis. So that was kind of an interesting observation that we saw there. And, in all cases that was observable. And then finally, the costs, the average costs once the COVID experience had settled down ended up higher than what we had seen before COVID. Yeah, so the higher claims levels lasted, at varying amounts based on mainly the severity of the diagnosis and the hospitalization, as well as underlying conditions. So severely hospitalized COVID patients, even 4 months after their COVID diagnosis, still had significantly higher claims. And really, it wasn't until about 5 or 6 months after the diagnosis when their claims were back to kind of a steadier, lower level. So overall, there was definitely delays in getting back to what we could call new normal levels of claims. However, for all the categories, the new normal levels of claims were significantly higher than what they were before their COVID diagnosis. So in the period prior, they were all the categories exhibited at least a 20% increase in their claims, even 6 months after their diagnosis. Part of this increase may be due to lower pre-diagnosis costs due to the deferred care. So there was a lot of deferred care during the pandemic. And if the period of deferred care took place before the month of diagnosis, then that would kind of artificially suppress our baseline of claims. For this study, we worked with Wakely and their data, and Wakely conducted their own separate study, and they looked at actual diagnoses of conditions and specific conditions where they saw that there was a worsening of those conditions following the COVID diagnosis, as well as increases in new conditions that popped up after COVID. So the combination of those two factors, certainly we would think would have helped to drive increases in the observed medical costs. And then lastly, there's the concept of long COVID. So long COVID generally hits several months after the diagnosis in terms of, certain persistent conditions that just, some of which pop up from the onset, from the diagnosis, and others come up later on after the diagnosis. We do need to be careful about, projecting or extrapolating some of these findings that we've discussed into the future. So because of certain factors that are contributing to that. So first off, you've got potential distortion due to the deferred claims during the initial period of the pandemic. But, in addition to that, there's long COVID, which kind of came into play. So even though that certainly we would think has contributed to the higher costs, it's more difficult to determine the impact of it because it's not generally used as a diagnosis or hasn't been used by a lot of the providers. So it's a little more difficult to really determine there. To access this report, please go to the Society of Actuaries homepage, click on Research Institute and Healthcare Cost Trends. As you click on that, we'll pull up the homepage of the Healthcare Cost Trends Strategic Research Program, and you can scroll down and find the report, which is titled Quantifying Long-Term Effects of COVID-19 on Healthcare Costs. As you click on that, you'll see a description of the report itself and a link to the report that you can click on and read in full. And we encourage you all to come and read our report. Thank you very much.